Hi, I'm Michelle and my question is punishment an effective behaviour modification strategy in children? So we know that corporal punishment such as smacking or spanking is widely used. 65% of women and 75% of men believe that sometimes children need a good hard spanking. 6 in 10 children have received corporal punishment from their caregiver. If you're between the ages of 3 and 5, you're more likely to receive corporal punishment. And the younger the parent, the more likely they are to give corporal punishment. But the most precipitating factor is a parent's positive attitudes towards corporal punishment. So even though smacking is prevalent, is it the best option? Empirical evidence has found that parental corporal punishment of children actually leads to a number of negative factors, those listed on the screen, such as aggression, high anxiety, low self-esteem. So what are we doing? Well, a number of countries have actually adopted policies and laws that prohibit parents from using corporal punishment. There are a lot of studies going on to figure out how do we elicit change behaviours in parents. Psychoeducation interventions are also being studied. Is psychoeducation paired with motivational interviewing a good strategy though? This is what my study paper is going to look at. So the article under review is Changing Orientations to Corporal Punishment. Efficiency of a Motivational Approach to Psychoeducation, conducted in 2016 by George Holden and Grant Holland. So the aim of their study is to evaluate the effect of psychoeducation intervention enhanced by a motivational interviewing approach on parents' corporal punishment attitudes, behaviour intentions, and reported behaviour. So motivational interviewing, what is it? Well, the goal of MI is to establish a strong rapport with the client so that we can elicit the client's own reasons for wanting to change their behaviour. And the other factors on the screen is how motivational interviewing is done. So, rationale for its use here? Well, we know that corporal punishment is an entrenched child-rearing behaviour. We know that it's widespread and the usage is often difficult to challenge. And we know that parents' positive attitudes towards CP is the most single factor in determining whether they use CP, and therefore we want to target parents who have positive attitudes towards the CP, use of CP. So the hypothesis in this study is fivefold. They want to see less favourable attitudes towards the use of CP, a reduction in the intent to use CP, a reduction in the use of CP, and increased motivation to change behaviours. And that would be precipitated by more change talk. So we're going to look at the method and design, including participants, measures, procedures, study design, and participant flow. So the participants in this study is 43 women who have children between the age of 3 and 5. The average age of the women is 32. The average age of the children is 4, and we can see the other factors there on the screen. Measures are 4 self-reported variables, and they're attitudes, behavioural intentions, the use of, and motivation to change. And these are the bits that they used to be able to indicate them. So the procedure was that they put flyers out to childcare centres and they had a number of exclusion criteria. The most important one is that parents needed to indicate that they had used CP within the last month with their child. So the study design, they had 46 women who were randomised. It was a randomised controlled trial, and they were randomised into the intervention group or into the waitlist group. They had baseline data taken from both groups. They had the intervention, a 48-hour post-survey, and then a 1-month survey. The same for the baseline group without the intervention, and then they underwent the intervention with the same surveys done at the same times afterwards. So the results of this study was that we found a significant decrease in positive attitudes towards CP in the group that underwent the intervention, along with a significant reduction in CP intention. There's no changes really in the waitlist group. What we didn't find though was we found insignificant reduction in the use of CP in both groups and an insignificant increase in motivation for them to change their behaviours. We did find, though, that there was greater change talk was associated with negative CP attitudes and less intention to use CP. And these diagrams here show that. So the conclusions. Brief interpersonal interventions combined with an MI approach can be effective in changing CP attitudes and behaviours. Although we have seen no changes in reported use of CP, this may be a methodological design error though, and no changes in the readiness to change, and this may be a methodological design error. So the limitations was it was a small sample size for a novel intervention. There were samples from a similar geographic area. There were characteristics of the clinician that probably worked against the study, such as it was a male with no children. And some of the methodological concerns were some of the survey questions weren't specific to corporal punishment, but were to general disciplinary attitudes. So the critique is that it was a great study design. It was a randomised controlled trial with a control group, so strong. It had an acceptable size. They did include another time point, a 1 month follow-up, more than some other studies with just pre-post. They had a replication of the intervention with the wait list crossover. And so what we want to know is if they studied it for longer, would the results be sustained? Could they have included more alternatives to use CP? Would multiple sessions of motivational interviewing and psychoeducation be more beneficial? And utilising professionals that parents trust, would this be more beneficial? So closing impressions, MI paired with psychoeducation of CP may be a cost-effective method for decreasing parents' positive attitudes towards CP, although more than one session is probably needed and a longer-term effects need to be explored. Thank you.